Hello, my name is Jim. Today we're going to go over how to reconstitute your brand new GLP-3 kit, your retatrutide. Show you what it comes with. It comes with GLP-3 retatrutide, which this is a 12 milligram vial. Comes 10, 20s, 30s, 46, depending on what you want. Alcohol wipes, bacterial static water, and syringes. Your syringes are 100 units, 5/16, 100. I'd remove the needle so I don't poke myself. First thing we're going to do is we're going to pop the tabs off, the lids. Take your alcohol pad, wipe them down real well. You don't want to get any bacteria in there. The test subject don't want to get an infection. We're going to pull this back to 100. Just like that. It's 100. Now we'll take the bacterial static water, put it in the center, push the air in, turn it upside down, draw out 100, take it out. Inside the retatrutide, the GLP-3, we're going to put it directly in the center. It should start sucking in automatically. If it doesn't, you may have it up against the side, not directly in the center. Pull back on it a little bit and see if it'll start sucking in, or just kind of push on it. You may have it jammed up just a little. It takes a little bit to get experience with it, to get it right sometimes. Okay, you just put 100 units in there. You got a 12 milligram vial. You got to put 20 more. So it's 10 units per milligram of peptide. So we need to pull it back to the 20. Shoot the air in. You don't have to rewipe it down if you're doing it consistently. Pull it back out to 20. Get it pushed down in there. Once it's done, pull it back to 100 with nothing in it. And push it in again, and you'll see it suck down. Because it's under vacuum, that's how they seal these things, so they don't get any bacteria in them. If it goes all the way down, pull it back out and do it one more time. That way you get the vacuum. It stops about halfway or so. Just give a little extra, push it in there, pull it out. You're done reconstituting. With this as a powder, you have to roll it. To get it to mix, roll it back and forth, just like you would do with, say, insulin, stuff like that. Make sure there's no clumps. Let it sit for 3 to 5 minutes. Make sure there's no clumps when you draw it in. To get clumping, it can be bad. Once you get done, take the whole kit, put it in the refrigerator. Whole kit has to go, and last like 12 hours if you don't. On injections, every 10 units is a milligram. Right there. So if I go back to here, there's 10, that's 1 milligram, 20 is 2 milligrams, 3 is 30. Okay, so your first 4 weeks on the test subject, 2 injections a week or 1 injection a week. If you do 1 injection a week, you go to the 20, pull the air back, you get your vial out, push the air in, pull it back to the 20, and on the test subject, grab some skin and poke it in, put it, be done for a week. Recommendations: two injections a week to keep it more stable. So if you're going to do 2 milligrams a week, you go to the 10 on the first one. Say like on a Sunday, you put it in, air, shoot it up, pull back to 10, and again, boom, keep it 2 inches away from the belly button on the test subject. And do that, say, Sunday and Wednesday, or Monday and Thursday, or whatever days you want to split it up to that. Run that 4 weeks. It takes it's a 7-day half-life, so it takes 4 weeks to actually build up in your system. So when you are in your test subject, if you put 2 milligrams in a week, after a week, there's still a milligram in there, and you're going to put 2 more in there. So now you have 3 at that time for the second week, and then you're going to have titrate up slowly. So it when it adds up, it takes 4 weeks to build up, and then it starts depleting what's ever in there. So you won't know the full effect until 4 weeks. But if you're not feeling anything by 2 weeks, you can probably go up another milligram. You just have to stay wait till about 4 weeks, and then go up maybe 1 or 2. See how that treats you. And if you start losing weight and it's going good, just stay there until you plateau, because that might be your golden spot. I have people on 1 milligram a week still losing weight, and I have some on 5 milligrams, 6 milligrams a week that are losing weight. So it depends on you. You can go up to 12 milligrams a week. That's what the studies have shown. It's 12 milligrams a week. I've heard people going higher, would recommend it. I don't think it's necessary to run that much, but at 12 milligrams a week, they lost 24% of their body fat. That's a lot. So it works really well. It's good for the kidneys, the heart, the liver, diabetes, insulin sensitivity. I run it for insulin sensitivity for working out, so it feeds the muscles. We do sell them in 10, 12, 20, whatever you need. You have to call me. We can't supply the wipes and the syringes every time you want to reorder. It's like an extra $10. The bacterial statin water is like $15 if you need that. It's good for about 3 months, as long as you keep it wiped off and keep it in the refrigerator. You can use this. This is 30 milligrams per milliliters, which is way more than what you need. We just got a better deal on it, so we can sell it to you cheaper. Good idea to check his blood pressure. We do sell blood pressure, $30 cost, just to keep an eye on it. Really good idea, especially if you're on medication for blood pressure and you start losing weight, your blood pressure is probably going to go down. So it's a really idea to have one and to keep an eye on it. And your fasting sugar, keep an eye on that. It's a really good idea. You want to make sure you're insulin sensitive, so you actually also can absorb nutrients. That really helps with the diet. High protein, low fat, moderate carbs. Don't eat before you go to bed. Worst case of heartburn, more likely in the morning or afternoon. You'll notice some of the side effects can be diarrhea for a few days, could be heartburn for a day or so. Sensitive skin, feels like you got a minor sunburn, not real bad, just you can just feel it, like you've been in a tanning bed a few minutes too long. But other than that, it works pretty well. It slows down your gastric emptying, so it makes you feel fuller longer. Me, I haven't had that issue. Like, I can still eat, but I can eat what I normally eat and still lose weight. So, and I have a pretty clean diet. So I'd recommend the cleaner the diet, the better it works, the more energy you're gonna have. It burns fat instead of carbs for energy. So it really works well if you have a really good diet. It burns a lot faster and makes you don't feel so tired like you're starving yourself to death. If you have any questions, you can message me. Thank you for listening. If I missed anything, just give me a message and I'll try to go over what I can for you. Thank you.